Hello, doctors. I'm Dr. Chris Rapoff of QME Continuing Education, and welcome to this week's presentation. I have a question for you. In your career as a qualified medical evaluator, have you ever had the opportunity to examine a firefighter or a peace officer? If you've answered yes, did your examinee claim PTSD as one of their injuries? Well, the passage of Senate Bill 542 now makes this claim made by an examinee easier to file for workers' compensation due to a claim of PTSD. The inference is that the stress associated with these occupations makes one more prone to mental distress and suicide. Now, today we explore a special report that appeared in the Commission on Health and Safety and Workers' Compensation Annual Report of 2023 as they examined Senate Bill 542 and its effect on these workers in particular. What did the study find? I think you're going to be surprised. So before we get started, these are the following sources that I referenced when producing this presentation. Feel free to copy and paste these links into your browser if you'd like to read more about the incidence of the mental health conditions or the illnesses among firefighters and police officers. Okay, before you answer that question I asked you at the beginning of this presentation, first of all, we know who a firefighter is and what their job duties are, but I ask you, is there a difference between a peace officer and a police officer? Actually, yes, there is. And the difference is a peace officer is a sworn law enforcement official with the authority to enforce laws, make arrests, and carry firearms. The term peace officer is an umbrella term that encompasses various law enforcement roles, including but not limited to sheriff's deputies, state troopers, federal agents, which would be FBI, DEA, ATF, U.S. Marshals, game wardens, campus police officers, and correctional officers. Now, these peace officers can be employed by a variety of various agencies at different levels of government, each with specific jurisdictions and responsibilities. For example, state troopers primarily enforce state laws on highways and state-owned properties, while federal agents investigate federal crimes and ensure national security. Now, in the difference, a police officer is, on the other hand, a sworn law enforcement official employed specifically by a police department or a force, typically at the local or the municipal level. Police officers are responsible for maintaining law and order within the designated jurisdiction, which can include cities, towns, or counties. Now, the primary roles and responsibilities of these police officers include patrolling assigned areas and responding to emergency calls, enforcing local and state laws, investigating crimes and collecting evidence, apprehending and arresting suspects, assisting in emergencies such as fires, accidents, and natural disasters, and promoting community and safety engagement. So now that I've made this distinction, I ask you again to answer my question. Have you ever had the opportunity to examine a firefighter or a peace officer? Maybe you just have. So as an introduction, on October 1st of 2019, Governor Gavin Newsom signed into law the Senate Bill 542, which created a rebuttable presumption that post-traumatic stress disorder, PTSD, in firefighters and peace officers is a work-related injury and thus compensable under workers' compensation. Now, department chiefs noted the significant impacts of suicide being a primary motivator to improving mental health supporters for firefighters and police officers and peace officers. On the other hand, having a healthy workforce was noted as being among the biggest cost savers that would result from the presumption. First, what is a rebuttable presumption? Well, it's a legal concept that's accepted as true by a court, but can be proven false with evidence. So the rebuttable presumption, according to Labor Code 3212.15, was added by Senate Bill 542, is in effect for specified injuries occurring between January 1st, 2020 and January 1st, 2025. In 2022, California Assembly member requested that the Commission on Health and Safety and Workers' Compensation undertake a study evaluating the wide range of topics from differences in mental health and suicide risks across the occupations to the cost impact of Senate Bill 542, all condensed in 12 research questions that they posed in a letter. Now, they contracted with the RAND Corporation to conduct this study that would guide future policy making. Some notable aspects of Senate Bill 542, as I've already mentioned, this bill creates a rebuttable presumption that the firefighters and certain peace officers diagnosed with PTSD have actually incurred an industrial injury. Some notable aspects of that bill do include a firefighter or a peace officer must have been on the job for at least 6 months for the presumption to apply. But there is an exception for a triggering event, which is sudden and extraordinary employment condition. Okay, now also this exception to the 6-month employment requirement for psych claims is an exception to the bar on post-termination psych claims as well. The presumption is rebuttable, meaning that it can be disputed and controverted by other evidence, but the presumption applies unless the WCAB finds that the presumption has been overcome. And a wide variety of firefighting units are covered, as well as large range of sheriffs, patrol officers, correctional officers, police, California Highway Patrol, and more. Other notable aspects of the bill is the bill extends the presumption following termination of a service for a period of 3 months for each full year of service, not to exceed 60 months from the last date that the employee actually worked. Now, PTSD is to be defined using the most recent edition of the American Psychiatric Association, DSM. Also, the bill is not retroactive and applies to injuries occurring on or after January 1st, 2020. And the bill sunsets on January 2025 and is repealed as of that date unless extended by later legislation. The research questions that were posed for this study include: number one, do the firefighters and peace officers have a higher incidence of traumatic stress injuries than people in non-public employment that poses a similar exposure to traumatic stress, such as emergency room personnel, security guards, and private ambulance service employees? Also, do firefighters and peace officers experience a significantly higher incidence of suicide, attempted suicide, or other serious mental health conditions than other employees in general? Additionally, are claims by firefighters and peace officers for mental health conditions denied when the condition appears to be job-related, but the employee had a difficulty in proving that fact? And was the rate of the denial statistically different from the denial of other claims by firefighters or peace officers that are subject to presumptions of compensability? Also, do firefighters and peace officers file claims for mental health conditions at a rate that is statistically different from that of other employees? Also, another question: are the claims by firefighters and peace officers for mental health conditions denied when the condition appears to be job-related, but the employee has difficulty in proving that fact? And is the rate of denial statistically different from what others claims and from other types of employees? Additional questions include: to the extent that the claims for mental health conditions filed by the firefighters or the peace officers are denied by employers, does this occur after prior treatment that was covered by an employer-sponsored or other health care coverage, when the treating provider concluded that the condition was job-related, or when there was no prior treatment or diagnosis? Again, of the claims that involve mental health conditions, what was the percentage of these claims primarily for mental health issues, and what was the percentage of these claims that involved a mental health claim as a compensable consequence of a claim for a physical injury? They also ask, To what extent are mental health claims filed by public safety officers post-separation or termination claims, as opposed to claims for which the employer had noticed during the term of employment? Another question. In the case of a denied workers' compensation claim by firefighters and peace officers for mental health conditions, is there evidence that the claimant later sought and obtained care through an employer-sponsored or other health care coverage? Also, what is the estimated cost to the state and local governments for each of the next 5 years under State Bill or Senate Bill 542 as enacted? And finally, what is the estimated cost to state and local governments of applying Senate Bill 542 retroactively? You'll be surprised to read and to hear some of those comments. Now, the methods employed in this study to address the research questions that were posed by the CHSWC, RAND used a mixed methods approach that included rigorous quantitative analysis of data from the Workers' Compensation Information System for 2008 to 2019 accident years, and the California Health Interview Survey from 2013 to 2019 period. Interviews were also conducted with medical chiefs and mental health providers who worked for the departments that had arranged means other than workers' compensation to support the mental health treatment for first responders. These next two slides, I will discuss a summary of the key findings, and I think you're going to be pretty surprised at the outcome. First of all, the mental distress and the suicidal tendencies were found not more prevalent among California's first responders than among workers in the other occupations who were exposed to trauma on the job. Surprising. Also, claims that were filed by firefighters and peace officers are more likely to involve PTSD than other claims by the average worker in California, but also are denied more often. Additionally, first responders' PTSD claims are denied more often than claims for other conditions, for example, cancer or heart trouble, with a presumption of it being work-related. Also, although there is often feasible to prove that mental health condition is job-related, there are many barriers that contribute to potentially avoidable claim denials. And continuing, they found that firefighters and peace officers also face barriers to care seeking, primarily mental health stigma, fear of professional consequences, and the lack of access to culturally competent mental health providers who understand the realities and the exceptional demands of their work. They found also that nearly all the workers interviewed filed workers' compensation claims for mental health conditions, but almost none received PTSD care paid for by the workers' compensation. Rather, nearly all paid for care out of pocket and sometimes causing severe financial strain. They also found that without Senate Bill 542, first responders' workers' compensation claims involving PTSD would cost state and local governments an average of $20 million per year in benefit costs. But under 542, costs for claims involving PTSD potentially is increasing substantially. And the cost under the Senate Bill 542, they're highly uncertain at this point, but the range is from $48 million to $347 million per year. And finally, a retroactive presumption covering PTSD with the 2017 and 2019 injury dates may cost, and they said they probably would have cost, at least $79 million, although they really cannot put a definite number to that. Wow, with those findings, they made some recommendations for future research. Obviously, this is due to sunset in 2025, so they're going to have to do some additional research. But they wanted a summary of recommendations for the future, and here are some of them. They want to revisit the question discussed in this report closer to the expiration date near 2025. A later report or a more retrospective evaluation would be able to provide a clear evidence on care-seeking patterns, claims denial rates, and claims costs with the presumption in place. Also, they wanted to conduct a qualitative investigation to examine whether Senate Bill 542 actually succeeded in reducing mental health stigma or promoting other changes in the department culture. They also wanted to gather more information about what details and evidence are requested by claims administrators and examine the claim denials resulting from the disconnects in the mental health provider documentation. Additionally, they wanted to start building an evidence base for better integrated systems that help deliver and finance mental health care for first responders and work-related trauma exposure. Additionally, they want to consult policymakers, departments, labor unions, and providers to find avenues for improving and accelerating first responder access to mental health treatment. And finally, they want to consider the mental health effects of the occupational trauma exposures and working conditions across a much wider set of occupations and industries. Well, this study was sure an eye-opener for me. We learned today that no, mental distress and suicidal tendencies are actually not more prevalent among California's first responders than among workers in other occupations who are exposed to trauma on the job. But what was equally surprising to me was the yearly cost of implementing Senate Bill 542 to the workers' compensation system. Finally, we did learn that they do plan to provide more data and more studies as the sunset date of 2025 is swiftly approaching. So will they pass this again, or just let it sunset and expire in 2025? Stay tuned to find out. So doctors, I'm Dr. Chris Rapoff, and I wanted to thank you for taking the time to join me in this presentation. And I hope you enjoyed it, and I look forward to sharing other interesting subjects with you as they relate to the workers' compensation system in the state of California. Until next time, thank you.